Welcome to Stoughton Media Access Cable's Dangerous Water Show. Today I am most pleased to be able to present you Tim DeBona. He's a local pediatrician. He takes more risks than anyone because he deals with children. So Tim, let me hear, what got you into being a pediatrician with these dangerous people that we call children?
So I think just to start, unfortunately, with a correction, I'm not an actual pediatrician.
Yes.
So I've been working in healthcare my whole life on the executive side.
All right.
So I partnered up with a very long time friend and she's a nurse practitioner.
Okay.
So as far as what got me into this?
Yes.
So I have been extremely frustrated with pediatric medicine for a very long time with the process. And there's so many pieces that, for instance, we saw telehealth come in during COVID.
Right.
And the technology for telehealth has been with us for 20 years. Why did it take COVID for us to get to a point to make things that make a lot more sense and make things easier for people? Why did it have to take the pandemic to get us to utilize technology to improve medicine, right? And there's so many uses for it. So I think that there's so many frustrations that I've had with the process, and I think a lot of innovation comes from people who get frustrated with things, right? So usually people get upset about something. There's got to be a better way. And just growing up as a parent, and I have two daughters, and right now they're 13 and 8, and of course they are my entire world. So
I like it. Very nice.
So but why can't things be easier? Why is it that when your child gets sick at 2 a.m, you have to go to an emergency room? Because even if, especially, I'm not sure if you've ever had this, but most first-time parents especially, you're extremely nervous.
Stressing.
You're pretending that you're confident, but you are scared. You are scared of everything. You're wondering if you're doing a good job or not. And then, there's a rash or there's some goop in the eye, and you're like, is this something I should do? Or is the fever too high? I don't know. And now you can't see your doctor, so you go to the emergency room and they hold you there for 6 hours. So, you're not getting home till 7 or 8 in the morning. Your children aren't going to school. You're not going to work. Your whole day's gone.
Boy, you sound like you've done this several times.
Too many times. And I am by far not the only person who's done this. So you see, so one of the simple things that we've done in our practice is we have telehealth 24/7. So if it's 2 a.m, you call us, and it's something where we can treat it over the phone, where it's like, okay, open up your laptop or pop open your phone.
Right.
Oh, okay, I can see what kind of rash that is now. I'm going to dial something into a 24-hour CVS. Drive over there, get your prescription, drive home. Everybody goes to sleep. You get a good night's sleep. You get to go to work the next day. Your children get to go to school, and you don't miss a beat. And things like that are just so common sense, and nobody's doing them. So there are so many gaps that we've identified that I've been sitting on this idea for probably about 7 or 8 years, and assuming that, especially with the mental health crisis, that we would see some changes coming in pediatric models. And then we've recently gone through this wave of what they call integrated behavioral health, to try to mix behavioral health, like mental health issues, with medical.
Tell me more about that, integrative behavioral health.
So the idea is that you have, people, and the simple way to look at it is healthcare is healthcare, and you shouldn't have to break it up between mental health and medical issues. There are so many things that cross over. The easiest example would be people who are, let's say you're extremely anxious, nervous about something, and all of a sudden you break out in hives, right? So something that you were dealing with mentally has now manifested physically.
Right.
And there are and it's just one of those things that are just so commonplace, and you would think too, even back from the days of Columbine, you would think all of a sudden people would realize things need to be much more aggressively pursued, but mental health has not been around nearly as long as medical health has. It's really been the last couple centuries that people have started delving into mental health and how to try to figure out treatments to help people out with anything from anxiety to when you're dealing with loss, whether it's like grief, survivor's guilt, and we have all these other items now, like we have eating disorders, we have separation of family, and and often people are very young, they don't really know how to handle this, and then all of a sudden you also have the adults, the parents, who don't really know how to treat it, And doctors do not get the education on mental health that you might think. They get about 4 to 8 hours typically of mental health throughout their entire education process. So they don't know much more than either of us know going into it. So the idea of finding a way to properly blend folks who are specialized in treating mental health conditions with folks who are managing the medical side of a patient is, you know, it's another one of those things that needs to happen, and because they're both pieces that are integral to how people are going to live their daily lives. Now I look at this, and you could do what we're doing with adults. I personally find adults boring. No offense. No offense.
None taken.
I mean, 9. You should see the kids at the practice when they come in and stuff like that. And I mean, but you just see the struggle. We have, one of our parents. She's barely over 5 feet tall, drives this massive Suburban, has kids pouring out of this thing. Like, I think she has 4 children that are coming out, and it's like, God love her. It's this, like, you can imagine the stress and how difficult it is just to make the drive over.
Yeah, if one is sick, then the 3 have to come.
Yes, and generally speaking, it'll be with a day or 2 in delay to make it as difficult as possible to deal with it. But but I find kids much more enjoyable to deal with. They're hilarious, they're cute, they're fantastic, and so and I guess maybe because of my absolute obsession with my own children, the idea was, let's build like something that can be just this beautiful home with brand new ways, a brand new model of pediatric medicine, and I want to, not only for this to shine, but I want people to steal my idea. I want people to come in and say, I like what Tim's doing with this, that, and the other, but I would change this a little bit. Cool. Have different versions of this to choose from so that it's not just the same old where, your child's sick and you're not going to be seen for 3 days or something like that, and all the pains. But on the mental health process, we see often that, you get the checklist. Are you feeling depressed and things like that?
Right.
So it's very easy to lie on those things. Now, if you're a 13-year-old girl, which I'm pretty sure you're not, but if you were a 13-year-old girl and you have an eating disorder,
You've
let's say.
got a great sense of humor, I'll give you that.
How many 13-year-old girls do you think are going to check off that they have an eating disorder?
About 0.
Yeah.
Yeah, that's not.
So you can't. So what we're doing is we're going to have these. So we have these mental health therapists. Whether they're social workers, psychologists, and they're going to be working hand in hand with our clinicians. All employed in the same place, have their own offices and everything like that, so that they can now train the clinicians, the medical clinicians, on what to look for. So if we ask maybe questions that aren't always asked, like, about how things are going in the family. So lately we've been really kind of starting in the medical community going around what we call social determinants of health, which are really like, what are all the other aspects that are going on, like, because people's diets matter and the conditions that they're living in matter, and so many other things that if you actually solve this, you wouldn't be getting sick nearly as often and needing to come in here. So if we're asking questions that could lead to us to learn that there's been a recent, unfortunately grandma passed away last week, and now is this an opportunity potentially for there to be some brief counseling? Because there are so many people that go through, we all have these items in our childhood, 3 or 4 items when we were less than 12 years old, let's say, that we remember when we get older, and they were defining moments, and almost all invariably they are bad things that happened, right?
Okay.
And
our filters put them there, yeah.
Yeah, right. Well, we hold on to like the negative. It sounds pessimistic, but the reality is that we gravitate towards negative items in our lives because they are very meaningful, and you want to make sure they don't happen again. So if you're embarrassed, then you're going to prepare better the next time you're going to a meeting or whatever. We use these in adulthood as well, but so you have these children that are going to potentially have some items of concern. I'll use my father as an example. My father, when he was 9, was on thin ice with his best friend. His best friend fell through the ice. He happened not to, and tried as he might, he couldn't save his friend. So my father still now, he was born in 46. And he still suffers from survivor's guilt. They never treated it back then. It wasn't even really identified as an issue. And it has had a terrible effect throughout his life. Decade after decade, he had ways that it beat him up, right? So I know so many people, myself included, where it was like, if that you're in your 30s, you're in your 40s, and you're like, man, if when I was 8 years old, if I only saw somebody, or if I actually had someone to talk to or to understand, you know, or just get the tools, because this isn't like something where you take a pill and the problem's solved. A lot of it is, you know, a connection. When you find the right person to meet with, you get very comprehensive discussions where you can then identify that you actually have something that you're suffering from to begin with, and then learn about what that condition is. How does it affect me at this age? Because if you are, let's say you have OCD, or let's say you have anxiety and you're 8 years old, and you've never heard of things like, let's say, yoga or meditation or whatever it is that works for you. It's just like exercising or anything else. You need to find what actually works with you, and through conversations with your therapist, you can discover this. But now you've learned how to deal with it, and then cut it off. Counseling should be like training wheels on a bicycle. You need this right now to get yourself to a point where you're confident and able to manage yourself. But when you get there, you can strip those off, and now you can manage your life yourself, right? That should be self-reliance at some point. But now this 8-year-old is in middle school. This 8-year-old all of a sudden has acne. They care about what they look like. Dating is becoming a thing. You have to do chores at home. You're doing more homework than you've ever done in your life. There's all these societal pressures. Maybe you're getting bullied or whatever. You're too short, you're too tall, your hair's too curly, you know, you hit puberty or too early or too late. All these, I mean, it's the worst part of life. 7th and 8th grade has got to be the actual toughest part of life. But now your tools aren't working as well, because when you were 8, you didn't have these items. So now why don't you go back to that same counselor or somebody that you feel like you can connect with, and go through the process again and learn, okay, now I understand these things about my condition, so you're probably coming in it with more confidence, you've had success with it, and now it's, okay, these things are happening, and then you work through in the same fashion with your counselor to a point where, whether it takes 6 months, 3 years, however long it takes for you to get comfortable to be able to manage yourself. And then, of course, adulthood will bring more challenges. But the idea is that there shouldn't be a fear. And the younger generations, if you look at it decade by decade, the proportion of people who feel comfortable receiving mental health services is just going all in the right direction. People are much more comfortable with it. They're more open with it. Sometimes they talk about it even with their coworkers, you know, in adulthood. And you know, it's fantastic, and these folks are getting the help that they need so they can manage their lives more confidently, so that by the time they become an adult, they don't have all these, whether it's insecurities or fears or being unsure on how to just get themselves to a very comfortable spot. They're waking up with anxiety.
So let me steer you a little bit.
Sure.
I get why you're so passionate, right?
Yeah.
You've explained it extremely well,
Yeah.
right? You want to share it. It's a business model. What is your business model? Like, we want to get you to be able to reach the most people here. What is it you're presenting from the point of view of, you know, we got a mission statement, right?
Yep.
We're going to try to bring people who need services together for a much more holistic ending, right?
Yes.
And continuation of that.
Yep.
But what's your business model? What is it that you're actually like pushing forward so that you can make more impact? Tell me
We
that.
are taking the ability for you to complain about pediatric medicine away. So basically, we're taking everything that everybody is annoyed with the product, and we're coming up with creative ways to deliver these services. We're creating connectivity between who your clinicians are going to be, so that we're finding, as everybody knows, the earlier you find out what's wrong with you, whether it's a medical, mental health, whatever the issue is, and the earlier it is treated, the better the outcome is always going to be.
Okay, who is we, and how do they reach you? So somebody who has a pediatric service, they want to reach you. Who are they reaching?
Who are they reaching?
What's the name of your?
Yeah, so we're HD Pediatrics.
HD Pediatrics.
HD Pediatrics.
All right. And what about a phone number? What about a
so
website?
It's 781-886-3020. I chose those numbers because they're very close to the town spa numbers, and I am born and raised in Stoughton, so I wanted to make sure I go with similar numbers, so maybe you made a mistake and you called us up.
Anyways, yeah.
And we're located on 1524 Turnpike Street, so we're in the little Dunkin' Donuts Plaza across from Target.
Nice.
And you can just email info@hdpedi.com. Or if you go to the website, which is just hdpedi.com,
Good.
you can see some videos of yours truly. I do fantastic in those. No, but we have all of our services and everything like that up
I
there.
love it. I look fantastic in those.
Yeah, it's a great thing, and the idea is basically like we're doing partnerships, so we're getting in.
That's what I want to hear.
We're getting into the community. So we just met with we're doing this thing over at the Y, right? The Old Colony Y.
Yep.
So we're meeting the folks over there. Me and my partner are meeting the folks over there. And I realized how much stuff they have and all these projects that they have going on. They have a food pantry and all these things I had no idea about. Because I remember Stoughton as a child. But now I'm coming back as a professional, as an adult, and I'm seeing it with all brand new eyes because
Right.
I'm grown up now. And I said, tell me everything you're doing. And so the director there says, it tells us about this homelessness program that they're doing. I said, well, explain it to me. And I said, well, we have lots of families, like whether they lost their careers during COVID, or maybe they've recently immigrated to the country and they don't have a home. They basically need something to hold them from anywhere between like 1 month and 12 months.
Okay.
And I said, what are you doing for the kids over there? She's like, what do you mean? I said, what about for the medicine for the kids over there? And she was like, we don't have medical notes on their past very often. We don't know when they've had their last physical. We don't know how they've had vaccines. We can't get them health insurance. We have no idea really how to help them. And we have an ambulance going there 3 times a week because every time someone spikes a fever, they're calling an ambulance. They don't have transportation means and things like that. I was like, well, why don't we help them out? So we're going over there. We're telling them about how to do preventative medicine. So in March, it's like, here's allergy season, or here's how you manage temperatures properly. We drop a laptop in all of those buildings, and they can pop it up, and we can do 24-hour telehealth to those folks who cannot travel around well on their own and only use an ambulance when it's needed. So, and we know how to set them up with health insurance. So we created this one-page form, gave it to the folks of the Y, and they give it to them. So anyone that wants our services, they just fill it out. We become their PCPs, and we sign them up for Medicaid plans.
Tell me about your funding. How are you getting funding to do all this? Nothing's
all
free.
It's all personally funded. So my partner and I have really beyond emptied our pockets out for this. We don't like the idea of dealing with investors. We are starting to look into grants. I've never dealt with grants before, but I think that 2/3 of our patients are on Medicaid. So we're really attacking the most vulnerable folks, very impoverished and very much in need folks. But we're treating everybody. We have plenty of patients from all the surrounding communities, from Canton, from Easton, Randolph, Brockton. So all the folks in the community is really who we're targeting. We want everyone to be a part of this who wants it. And our location is right where, there's 24, 93, 95. So even if someone's living in Quincy and they love the idea of this model, if they're close enough to the highway, it's a 20-minute drive and they can come over to us.
Okay. I need the model more clearly for me.
Okay.
Maybe the audience might have jumped over what I'm understanding.
Sure.
But who's your client?
Who's my client?
Who's your client? Is it a service? Is it a pediatrician? Is it actual people?
Yeah,
I don't understand.
we have 2 clinicians right now.
Okay.
And so they're the ones who are providing the treatment for all of the patients that come in.
Okay.
So our medical office is right there on 1524 Turnpike Street. So the folks come in. All of our rooms have different themes to them. You can go to the Harry Potter room.
So are you a clinic?
Yeah.
Okay.
We're an outpatient clinic.
You're an outpatient clinic
Yep.
with access and sort of directives to get Medicaid payments.
Yep.
And to work with other clinicians
Yep.
to establish telemedicine.
Absolutely.
Okay.
Yeah.
Keep
Telemedicine
rolling
is
with me
just part
because
of our services. So we're just like any other PCP that you would get as a pediatrician. So we have a male pediatrician, Spanish-speaking pediatrician, and we have my partner Robin, and she is amazing. And so the patients come in, and then we just give them all their normal primary care type of services. Everything from getting your vaccines to getting tested for whatever it is that you have to be tested with, strep or whatever it is that your child is suffering from. And we do all of our services right on scene there. And if they then are at home, we have the call-in line like any other place has. You can have an on-call clinician, and it doesn't go to a nurse, it goes straight to our clinicians too, because that was another gap that we thought was important. And if it turns out that it is something that is more complex than just a simple question, we convert it into a telehealth visit. So all of a sudden they flip over.
Do we need a reference to come see you?
No, you can just come in. We do meet and greets. You can check out the place. We have all these textured walls. We have so many children, especially like we had a child that came in today with autism, and he spent like 20 minutes just like touching the walls and looking at all the different pictures we have all over the place. So the place is it's a brand new construction. We just built the place too. So and like I said, all the rooms are themed, very bright colors too.
Good.
Yeah, it's a beautiful place, and the kids absolutely love it. Parents love it too. And so we schedule meet and greets, so you can come in, you can get a tour of the place, you can meet the clinicians and stuff. So kind of almost like a look before you leap. You know, like I'm considering it.
Yep.
This place is either more convenient, or I like the idea of what it is that they're doing. This could help us out, make our lives easier. So come in, meet the clinicians, or bring your kids and have them meet the clinicians.
Say that phone number again.
That phone number is 781-886-3020. Call today.
Yeah, so call, and you've got people on staff.
Yes, sir. We have we have folks on staff. We have medical assistants. We have everybody ready, and you'll get an immediate response. We have all same day appointments too. So even if someone, I don't know what time it is, what is it, 2 o'clock? Someone calls right now and they said they need to be seen today, they're being seen today. We keep gaps open in our schedule to make sure that no matter what, if your child is sick, your child gets seen.
Let me ask you, if the Health and Education Secretary for the United States,
Yeah.
and they call you up and they say, tell us about your program.
Yeah.
Can we go to scale with it? Tell me about that.
No question. I'll tell you this. I do not have plans to open many of these, but I do have plans to spread the word about this and tell everybody what we did well, what didn't work out, and how to improve on this model. I am very happy to openly share my secrets. I'm not charging a fee for that. I want people to know how to do this, because this is what I want to kind of take over pediatric medicine. I want this to be a landscape change, like a revolution in pediatric medicine, really. So I would love to entertain the thought of connecting with anybody, whether it's anyone from the select folks in Stoughton, the mayor in Brockton. We have met with the mayor a couple times. And I would love to work my way all the way up there and dictate, here's what we did, here's how we accomplished what we accomplished. This is our philosophy behind this is why we're doing what we're doing, and most importantly, here are the results that we found. And I think we're going to have amazing outcomes. I mean, we've already seen we have some success stories too already. And even just the program at the Y has been fantastic, and I never planned on that. You know what I mean? Like, so the idea is every time there's something there, is that we just creatively find a way to deliver our medicine to whoever it is that we can.
What's your biggest strength for this company?
Personally, well, my position is Chief Fun Officer, and that's there for a reason.
Okay.
So, well, it sounds a lot better than...
Not finance officer.
No,
Officer
no.
of fun.
I mean, on legal documents, I'll write CFO, so I kind of fool them. Hopefully the auditors aren't watching right now. But yeah, I basically manage the business side of most matters. So with most clinics, you don't typically want them run by a business person, because business people will say, will tell the clinicians, you have to see a patient every 10 minutes.
Yep.
And boom, pop them out, so that way we make the most money.
Right.
So businessmen typically aren't the best to run a clinic.
Okay.
And then clinicians aren't great at it either, because they've never been trained in business. So they'll make sure they deliver great care, but those are the places where you walk in, you see it's like on eggshells, and the receptionist doesn't get along with the MA, and it's like all tense there because they don't deal with items like that directly. So now I deal with business matters only. I don't deal with clinical matters. And my partner, she's a nurse practitioner, she deals with clinical matters. And we have a little bit of crossover, but for the most part, we stay in our lane, and we just use the best of our abilities where we're at our strongest. and we cover each other's blind spots, and we make sure we're delivering great medical care, and we're doing it in a financially responsible way. And the reason why I like to have the chief fun officer thing is because, again, I'm not like I'm not a stuffed suit. I want to have fun. I want to go engage with the families. We had somebody come over the other day, and she was really upset. There was a personal issue going on with the father of her child. They weren't getting along well, and she had to request something. So I just walked her over to Dunkin' Donuts, bought her a coffee, had her just kind of like settle in.
Yeah.
But it's like that there's an element that where that's missing now, like the call back after your child is sick, but we want to check in and see how you guys are doing. You know, you don't get that really anywhere anymore.
It's tough when you're just operating on P&L, profit and loss,
Yeah,
right?
yeah.
So tell me a little bit about the seed, the germination right there. It started with your dad's story, but what was the beginning seed that you planted for this wonderful idea?
Where
Like,
did it come from?
Where did it grow from? I know that the story about your dad is heartwarming, having lost a friend that he couldn't do anything about.
Yep.
And so that brought you to this, I think, an intense level of caring in your life.
Yeah.
But what planted the seed to do this, what I will call a massive undertaking for like more the benefit of people than yourself?
I think that it stems from my children. My children both have conditions that are being addressed right now as well. And I feel like under different circumstances, like maybe a generation from now, if this whole idea catches on, that things would have been figured out a little bit earlier with them, and they could have been, dealt with at an earlier time. And we could have had better outcomes. Now, my kids are doing fine. They're doing very well. But it's hard not to be pulled by your heart towards all of the sorrowful pieces that have happened, especially to children. And I cut children a lot of slack that I do not cut to adults. We make our own decisions, and we're in control of a lot of what we do, whereas the kids have so many influences being pushed on them that I feel like they end up often on the wrong side of items that they had no control over to begin with. And I guess I feel for them. I don't know how anyone can't that has a heart. And I feel like there's so many ways that we can just make their lives better. And I think that's really where this is coming from. And I guess also, like I said, from a lot of frustration that there hasn't been this push to significantly change things in the era that we're living in. Like in the era that we're living in, where you have, the gun violence in schools, and you have all these pieces that leave people in fear. So I feel like the reimbursement, like social workers get paid extremely poorly. There's not much, there should be more of a push in reimbursement for this services,
Right.
and items like that. So.
Right. Well, it's time for us to close. This has been Stoughton Media Access Cable's Dangerous Waters Show. I'm so thankful to have Tim DeBona on it. He's got a great idea for health care for children, and we look forward to you helping him produce that idea. Thanks for being on the show.
Thank you very much. We'll see you at HG Pediatrics soon.
These are some dangerous waters. Ride with me.